Yes.
Next speaker would be Dr. Nilesh. He's a comprehensive ophthalmic surgeon currently working as a consultant at Ayodhya Eye Hospital. He has innovated the novel smartphone-based gonio imaging device, also known as the DIX Pro, which has won multiple awards at different innovative sessions. He has special interest in academics and research and has authored around 60 published papers and has presented over 40 papers and has been invited speaker also. His current area of research is smartphone imaging and medical retina. Over to you, Dr. Nilesh.
Thank you so much, sir.
Thanks,
Thank you so
Nilesh,
much
for
for this
joining us.
comment. Thank you, sir.
Yeah.
I'll just share my screen, sir. So, shall I start, sir? My screen is visible?
Yeah.
Yeah, sure. Thank you, sir. Good evening to everyone. I would like to thank TNOA for bringing me in on this wonderful session. I'm Dr. Nilesh Kumar, innovator of DIX Pro, and I am here to share my journey till now. These are my disclosures. DIX Pro is one of its kind frugal commercial smartphone-based gonio imaging device in the process of patent application, which is compatible with 2, 3, 4, or 6 mirror gonio lens and smartphones, a single or a multi-camera setup. This is how the device is set up for use. We place the gonio lens in the adapter, which by design aligns centrally with the optics of the smartphone holding segment, where the smartphone, be it an Android or a smart iPhone, is snap fit. Normal camera app or MI RedCam app can be used for clicking the image. The lens with the holder is applied in normal fashion under topical anesthesia, and the patient is asked to look straight. The smartphone segment aligns beautifully with the lens adapter, and you just click using camera flash. As simple as that. These are few sample images using Vogue 4 mirror lens. These are few sample images using Ocular 3 mirror lens. But I am here to share my journey, how this journey has been till now. The two most common questions asked to any innovator are, how did you get the idea? And how did you decide to take it forward? I will try to answer these two questions in today's presentation based on my learnings and my interactions with much better innovators. Everyone has got ideas. When presented with a problem, any logical brain will throw out a solution. So anyone in the audience who wants to innovate, focus on finding a problem. Find a problem that is very personal to you and that you really want to be solved for yourself. And then let the brain do the magic. My problem was convincing the patient that they had closed angles and they required YAG PI. Even after counseling them for 15 to 20 minutes, they rarely agreed for such a simple procedure, all because they couldn't understand why this junior doctor is convincing me so much for this procedure when I just walked in for a routine refraction. The only way to convince them was to show their angles. Did I ever set out to make a device to solve a problem? No, I just wanted some idea to solve the problem. What did my brain throw up? What is gonio mirror? Is it not a mirror? Are you not taking a mirror selfie with your phone? Can't you do the same by going really close to the gonio lens? This idea came to me in a gym. But that is not all. It is not that I just got the idea in the evening and next day DIX was born. It took me 8 to 10 days just to gather courage to attempt the imaging. So how the journey has been till now. Ikigai is a simple Japanese philosophy meaning reason of being. It asks to answer only 4 questions about anything you want to do. And if you answer those truthfully, you will have the clarity whether to do it or not. The questions are, do you love doing it? Are you good at it? Does the world need it? And most important, will anybody pay you for doing that? So first question first, do you love the idea you have got? If you don't, be ruthless and discard it. Sole reason is that it is going to take up a lot of your time, a lot of your cognition, and a lot of your attention. It took us 12 different type of macro lens setup that we had tried over first 6 months to get from the first image that is on the left side to a clear quality image in the middle. So make sure you love your idea because that is going to become your passion. The next question to be answered is, are you good enough to implement your idea? This decides the route you are going to take to develop your idea. If you can do it, then take the do-it-yourself route. That will give you complete freedom to keep developing the idea. If you think you can do it, but lack direction, then a mentor can help you. I was lucky to get Dr. Ashish Sharma sir even before I started my journey, which has helped me to achieve what I have today so fast. Getting a right mentor will not only help you to do what you need to do, but they will also prevent you from making the mistake they had made. And if you are not at all, you have no idea about how to go ahead and you can't get a mentor, then somebody from the industry can help you. But if you're going to take that route, please make sure that you have some protection of your idea. The third question to be answered is, does the world need your innovation? In simple terms, is your problem also a problem for a significant number of your colleagues? And is there no viable solution available for it? For me, gonioscopy is not performed in majority of the patient walking in, and there are no recent advances in gonio imaging which are frugal and can be utilized for patient education that convinced us to develop our innovation further and propagate it. We published the technique in Journal of Glaucoma, and the quality till then was so good that it made it to the cover art also. The last question that really decides whether your innovation is going to be commercial or not is a very simple question. Will someone pay for it? Once we had published the article in Journal of Glaucoma, we got so many queries. Is that a device? How can we buy it? That answered the question for us, but it is a very complicated process. Commercialization is also very costly. Developing even a simple attachment may cost you 5 to 6 lakh, and thus economics needs to be understood before proceeding. In my opinion, your research and your innovation should be self-sustainable, that it should pay for itself. But have we done all we could have done with the device now that it is commercial, has won multiple innovation awards, and is present internationally? Not at all. The beauty of innovation is that it keeps evolving. The next frontier to be achieved is the reflection-free image. We are experimenting with various polarized lights, filters, and external flashes to provide a reflection-free 360-degree image of the angle. And hopefully we will be achieving that soon. This all is possible because I answered the first question very, very truthfully. I love my idea. I absolutely love my idea. Keep loving your idea, keep innovating, keep translating, keep digging. Thank you so much for this opportunity.
Wonderful, wonderful, Nilesh.
Thank you so much, sir.
Beautiful, beautiful. What is the cost you said?
So 25,000 right now is the selling price, sir.
25,000.
Yes, sir.
It's available commercially?
Yes, sir. It is available with Dr. Ashish Sharma's MI Cam company.
Oh, okay. Fine.
Yes, sir.
Same company. Okay.
Yes, sir. Same company, sir.
Okay, over to the panel. Suvan, Kumar.
Yeah, I am full of appreciation for this, and to get an early break in two ways. As I mean, of course, he's been persistent. I've been following Nilesh for a very long time. He's done fantastic work, and actually, you have to have those good breaks also, like getting on the Journal of Glaucoma cover. It gives you a huge coverage, and like you said, joining Ashish Sharma, and Ashish Sharma actually taking him under his wings is kind of shortens that journey. It makes that painful journey. The journey will be painful. Rest assured, but it's going to be shorter, and it's going to be more pleasurable. And when you meet with failures, you have somebody to guide you and hold your hand and take you through those failures, and kind of keep pepping you up. That a mentor does very well, and you're very fortunate. And I think it's very nice of Ashish to take you under his wings.
Sure, sir. Yeah.
Kumar.
Very nice. I really like the idea. I think it's brilliant. I have only one question. The last photograph of the Astro is taken by whom?
So that is Windows wallpaper, sir. That is Windows wallpaper.
That's a Windows wallpaper. I thought somebody took that image of yours. That was a brilliant image anyway. But I love your idea. It's excellent, I think.
Thank you, sir.
Congratulations.
Thank you, sir.
Excellent, Nilesh. Just to say, see, the innovators are not many. Maybe 2% of any ophthalmologist or even the doctors around. But I think the early adapters are very important. That's what Suvan also keeps telling. So you'll have to really look for early adapters of this technology. Even though it is simple, sometimes it's that early adapters will make a big difference. Once they start using it, they start talking about it, then it is into 10 times the Journal of Glaucoma, and the reach is more. Because as you said, it's very important to convince some patients. Even now you can take brilliant anterior segment, fundus image, show them diabetic retinopathy, glaucoma. Definitely you can add some educational value, but showing a narrow angle is also equally important. Making them understand between an open and a narrow angle, and how iridotomy would definitely save from having an angle closure disease. So in that context, I really agree with you. You know that there is a problem and you really wanted to solve it from the patient side. None of the doctors were bothering about this because we are seeing the angle. but you are thinking, how can a patient see the angle? So that is where, when you start looking with the patient shoes on, I'm sure there'll be a lot of innovations coming in patient care. Good job. Keep innovating. Yeah. Even in your private practice or wherever you are now, I think you should find that time to keep thinking like that.
Thank you, sir.
One word, Nilesh, we are blessed in India. The key opinion leaders are very accessible. So I would strongly recommend you get in touch with the key opinion leaders in the field of glaucoma, in the general ophthalmology field. They are very supportive, and trust me, overseas it costs a bomb to get KOLs on board. In India, it just it's their blessings.
Yes.
So it comes without any strings, and I was very fortunate. I must tell you, and my colleagues have been very kind to me, seniors, colleagues, all of them. So you latch on to some KOLs, and once the KOLs start endorsing your device, it makes your journey a little easier, because after all, the common surgeon, the average surgeon does look up to KOLs for the opinion. So key opinion leaders make a difference. So get in touch with the people in the field.
Yes, sir. It is really unfortunate for me, sir, because when I started commercializing the device, lockdown happened. The entire journey has been in the lockdown. So I'm just waiting for a physical conference to happen so that I can show the device to all the senior people. So then, because it is very hard to believe for somebody that without a slit lamp you are going to take an image, and that too with such a high intensity flash, and still you are going to not really distort the angle. So I just want everybody to have a hands-on, and then they can also, that is also very important for me to get the feedback, sir, so that I can further improve the device.
You should make a book, okay, like an atlas, a picture atlas, on imaging through your device.
Sure,
and
sir.
That itself will help you do the rest of it.
Thank you, sir. Yes, sir. I'll definitely start collecting the photographs for that, sir.
I think your photograph quality is really fantastic. That what you showed really is very, very, very nice. And I agree with Suven that KOLs are very, very important for all innovations, because these guys can actually be the what do you call the game changers for you. In my opinion. And JK, you're keeping quiet.
No, it's very interesting. Each presentation I saw before, most of them, they're so nice. These young people it's very interesting. Initial days, my days, as Suvin said, everybody look at me like an animal, but now look.
Absolutely, bang on.
Who is this guy? He came from somewhere and is talking nonsense and wasting everybody's time. They used to think when I say something. Now I am enjoying. Each one is beautiful, wonderful. One day I hope I will see in world platform Indian ophthalmologists before I retire.
And already I think Indian ophthalmology is shining in this area, because a lot of innovators, a lot of opportunities for these guys, and technology. They are combining the technology and they're making use of the technology. And RK sir, you would like to say something, sir?
It's a wonderful innovation, Dr. Nilesh. Congratulations. One question, especially in case of congenital glaucoma, where you do EUA, examination and anesthesia, can be used in a lying position to take the angle photos?
Yes, sir. Yes, sir. This device can be used both in sitting and lying down positions.
Okay, wonderful. Then it's a wonderful device. Yeah.
Thank you. Thank you.
Yes,
sir.
most of the time we are not able to document the congenital glaucoma, the angle. We see, but we're not able to take a proper picture or something like that. No?
Yes, sir.
That's great. Good.